Hey guys, it's great to see you all. Wanted to come to you with a little bit of a different situation. Every now and then I come to you guys with celebrity health news, sometimes interesting or unusual medical stories as well. You guys might remember the case report that I mentioned to you about the man who ate too much black licorice and ended up having heart problems as a result. Well, I wanted to, and of course I do, COVID information and general health stuff too. But I wanted to talk to you about a case report I just came across that was published in the New England Journal of Medicine. This was published in December 2021. Honestly, I think this is a fascinating case report that I've been planning to talk to you guys about for a little while, and today just seemed like the right day to do it. So I'm going to read to you from the New England Journal of Medicine. This, again, is the case report from December 2021. And it literally, the title is called Ectopic Tooth in the Nose. Yes, this is about a patient who was found to actually have a tooth in his nose. So this is the story, okay? And I love stories, so that's why I figured I would come and tell you this, because I read this and even as a doctor, I was fascinated. You guys often tell me you feel like you're in medical school with my videos, so here we go. 38-year-old man. Man is 38 years old. He presented to an ENT clinic, otolaryngology clinic, with complaints of difficulty breathing through his right nostril. So this is my right. I don't know if it looks like the right to you as you're looking at me. I don't know which way you're looking, but the right nostril. He said the difficulty breathing had been going on in his right nostril for several years. Okay, so 38 years old, difficulty breathing in the right nostril for 7 years. Usually when we see patients and they're coming in with a complaint, we ask them when, what, where, how, why, all that good stuff. And so those questions were asked as well. He said he had no history of facial trauma, which means there was no, well, you know what facial trauma is, right? So no major trauma to the face. And he didn't have a history of craniofacial abnormalities, which means, anything going on with the structure of his face, his head, abnormalities, whether it's their things that he was born with or what have you, developmental issues, or in terms of how his bones developed or anything. He didn't have any craniofacial abnormalities. Okay. The doctor then does the physical exam. And on physical exam, he was noted to have a septal deviation of his nose. Okay, so the septum kind of runs down the middle and it was deviated. You probably heard of a deviated septum before. A lot of people have deviated septums, and sometimes it causes problems with breathing and sinus issues and things like that. Maybe you guys have deviated septums or have heard of it. Anyway, he also had calcified septal spurs, which I'll be honest with you, I'm not really quite sure what that is. I'm not an ENT, I'm a family doctor, and a 2 centimeter perforation in the posterior septum. So 2 centimeters, by the way, this is how I gauge about 2 centimeters. If you bring your thumb in like this is sort of a very quick and dirty way that I measure about 2 centimeters, because it's about this length, okay? Perforation in the posterior septum. So that means there was some sort of a hole. Okay. They did a rhinoscopy, which means they took a look and they found a hard, non-tender, so it didn't hurt, white mass that they saw in the floor of the right nostril. And actually, there's a picture. I'm going to show you the picture. I think this case is so fascinating. I'm going to bring this closer. I'm going to try to avoid the ring light. There we go. You guys see that? So it's this picture right here. So when they put the thing in the when they went to look, they saw this and that white thing in there. And for those of you who are on YouTube, I know YouTube is watching. I hope you guys can see as well. Okay, we'll bring that up a little bit. There's that white thing. Okay, right. So that's what they see. So it was hard, non-tender white mass that they saw, and that was at the floor of the right nostril. Now, what they then did was they did a CAT scan. They did a CAT scan of the sinuses. And what they did when they did the CAT scan of the sinuses is they saw a well-defined radiodense mass that was consistent basically with a tooth in the nasal cavity. So let me show you that one. I don't know if you guys, let me know if you guys think this is interesting. I think it's fascinating. So I know this is probably hard to see and understand. This is a CAT scan, the nose. This right here, see if I can, that is like the thing. That's the tooth on CAT scan popping up, right? Not supposed to have a tooth in the nose, y'all. Fascinating. So they do this CAT scan, which they thought very likely, right, explain the reason why this gentleman was actually having, difficulty breathing in his right nostril that had been going on for years. It was like a tooth. So what they did then was they removed the tooth. They had oral and otolaryngologic surgery. Never can say that. Um, and they removed the tooth. It seems like there was no post-operative complications, which means he did okay after the surgery to have the tooth removed, which is good. And then even at 3 months after the patient had the tooth removed, the symptoms, he was still doing well, and the symptoms of nasal obstruction had resolved. Once again, I'm going to show you this tooth again because I think it's insane. They look in his nose and they see a tooth, which is pretty freaking wild, right? There it is. And then this is it on CT right there. Okay. So I was kind of curious about this thing, and I just took a look, and there are case reports of people reportedly having, not reportedly, but having teeth in their nasal cavity somewhere, stuck up in there. And there's a number of reasons, a number of sort of philosophies that are floating around about why this may happen, where somebody gets a tooth stuck in the wrong place, such as their nose. Okay. It's absolutely fascinating to me. Obviously, this doesn't happen a lot. This is a small percentage of the population. But this brings me back to the family doctor in me, which is that sometimes we deal with things for a long time that we just say, oh, this is just the way I breathe, or this is the way my nose works, or this is the way I'm always congested, or my back always hurts, or my foot always does this funny thing. Or I had a patient recently tell me, and she didn't even realize the importance of the symptoms she was telling me, but she was like, oh, yeah, every time I go out in the cold, my fingers always turn a different color. And she'd been living with that for a long time, but that's something that as a doctor sort of makes me like, bing, what? Wondering about autoimmune disease, things like Raynaud's condition, other things. My point being is to you guys, and let me know what you think about this case report. I don't know, do you guys think it's as interesting as I do? Because I think it's absolutely fascinating. But this is the thing. It's not to make you a hypochondriac and to worry about every little thing that you have and every little symptom and this and that, because we are humans and we are going to have lumps and bumps and injuries and things that we may not be able to explain. And it doesn't mean that there is something wrong with us just because we have them. Okay. But on the other side of that, this message that I want to give is to encourage you to maybe not necessarily write off stuff that you perhaps have. Okay. And it doesn't necessarily mean you have to go to the doctor and say, oh my God, I watched this Dr. Jen. She says I need to get everything checked out. I should not ignore anything. So I'm not ignoring anything. So what's this? This is, you don't have to go all, you don't have to do all that. But the idea is it's important for you to have an answer or maybe some explanation or even just a little discussion about some of the things that have been going on, just so you get insight into what it is. Maybe it's not about finding out if there's anything wrong. Maybe it's just understanding why. Hey, doc, why is it that when I do this, my foot does that? Or how come when I do this, my knees pop or they creak or, whatever it is, this is really what your family doctors, your internal medicine doctors, your primary care doctors, this is what we're for. On the other side of that, though, is every now and then we might find or discover something that is really important and serious and may affect your health, like the guy with the tooth in his nose, which I still think is kind of crazy. He said he'd had nasal congestion for years, which once again, look, if you have nasal congestion for years, I hope you come in so we can figure it out, get you to the right places and do what we need to do. That goes to say for everything, remember you matter. Remember your medical condition and your medical health and stuff like that matters. So, keep that in mind, guys. I think this is fascinating. If you want to read, that's the full case report that I just read you, but if you want to read more about other people who have been found to have teeth in their noses, which that is a thing, go ahead and Google it, because there are plenty of case reports out there, even though it is relatively rare in the community. Guys, I'm Dr. Jen. If you've not liked and followed my page, I invite you to do so. I do all sorts of videos. For those of you who send stars, I see you. I'm going to respond to you personally. Thank you so much for doing this. Let me know if you like this case report, if you thought it was interesting, and if you want to see more things or want to hear more case reports like this. I think this stuff is fascinating. It's actually out. Did you see that? I was like hit me in the face. It's actually one of the reasons why I became a doctor, is because this kind of stuff, I'm like, what? So let me know if you want any more stuff like this, because I do think there are actually learning lessons in all of this stuff, to be honest with you. For those of you on YouTube, I see you guys. Please make sure you subscribe to my channel and click the little bell for updates if you haven't already. Guys, I am Dr. Jen. I will see you guys soon. Bye. Bye, YouTube.